Pelvic venous disorders are a grouping of diseases of the veins of the pelvis that traditionally in women have been called pelvic congestion syndrome and in men are called varicocele. Whether you're male or female, pelvic venous disorders cause varicose veins to form in the pelvis, and those varicose veins cause symptoms of pain and heaviness and discomfort, especially at the end of the day. Risk factors for pelvic venous disorders in women primarily is pregnancy, and usually after multiple pregnancies. In men, varicocele can present at birth or in childhood and then progresses over life. The veins in your pelvis and in your abdomen are just like veins in your legs, like varicose veins in your legs, and they have valves. And when the valves are faulty, that causes blood to reflux or fall with gravity down into abnormal veins like varicose veins and pool. Those pooling varicosities in the pelvis or in the scrotum, in the case of varicocele, cause pain and heaviness that's worse at the end of the day. Pelvic venous disorders aren't dangerous to the patient, but they will progress over time. And so if the patient's experiencing pain and discomfort and it goes untreated, it'll likely just become more painful and more uncomfortable over time. Often the diagnosis of a pelvic venous disorder is found incidentally by a primary care physician when the patient expresses discomfort. They're referred to a vascular specialist, such as the Vascular Institute of the Rockies, where we have certified vascular ultrasonographers that can do transabdominal ultrasound and look for varicose veins in the pelvis or in the scrotum. If you find varicose veins in the pelvis, then you would do a more detailed analysis with ultrasound to look for broken vein valves or venous obstruction, which can cause the varicose veins to form in the first place. Treatment options for pelvic venous disorders are largely endovascular. We would access a vein in the neck and take a catheter down and look for reflux in either the ovarian or the testicular veins, and if you find those, then you can embolize those veins or shut them down with a mix of coils and foam like we would use for spider veins in the lower extremities. Recovery time after an endovascular procedure for a pelvic venous disorder is relatively minimal. Patients usually have a little discomfort or bruising in their neck where we did the access for the procedure, and sometimes can experience cramping or discomfort that's treated with ibuprofen over the course of a day or two. But often patients are instantly relieved of many of their symptoms and go back to a normal life very quickly.